Today we're going to discuss IV starts. Prior to going into the room, you're going to want to make sure you have all your equipment. So, to get all your equipment, the things you're going to want to gather are an IV catheter. We've discussed the different sizes in lecture. You want to take in 2. Remember, this is kind of a insurance policy to make sure you've got an extra just in case you need it for peace of mind. You're going to want to get an IV start kit. In your IV start kit, you're going to have a tourniquet, you're going to have tape, you'll have chlorhexidine, you'll have a tegaderm, and you'll have some gauze. You'll also have a label for your IV. Then you're going to want to get your syringe. You're going to want to have at least 2.5 to 5 cc's of normal saline. Your syringe might not be this big, but you will need one. Then you're also going to want to have extension tubing. This is what you're going to hook your IV into. So when you open this extension tubing, this cap is the cap that will be away from the patient. You can insert all of your medications into this port right here. It is designed so that when it's not in use, it's closed, so bacteria can't get in and blood can't get out. So you need to make sure that you leave this cap on. It does unscrew, but your IV should not have this open port. It should always be capped. This is the end that's going to be attached to your patient. When you get ready to put your IV in, you're going to want to make sure that you have this cap off, and you'll take this cap and you'll put it back in here once you have your flush attached. So, you also want to open your IV start kit. The chlorhexidine that comes in your IV start kit might look a little bit different. So there's 2 different types of chlorhexidine. There's chlorhexidine with the sponge, and then there's an older style chlorhexidine with a vial that you pop open. So either one of these can be used to clean the skin. All right, so let's get...
All right, I'm going to demonstrate how to attach your flush to your extension tubing. So you're going to start by opening your flush. When you open it, you're going to want to make sure all the air is out. So if it's not, you're going to draw back to release the pressure and then gently squeeze all of the air out of here. We're going to put this cap back on just for a minute. And now I'm going to open my extension tubing. When I open the extension tubing, I'm going to take this, you've got 2 different ends here. This is the end that's going to go to your patient. This is the end that goes to the saline. So I'm going to attach this right here like this. Then I'm going to take this cap off, and again I'm going to squeeze all the air. I'm going to use this to just flush all the air out so I make sure there's no air in the tubing, and I take this end that goes to the patient of the extension tubing and put it back in the package so it stays clean. When you're applying a tourniquet to your patient, take the tourniquet, pull the sides, reach under, and then tuck it over so that it creates a half bow with the flaps away from your site, your insertion site.
So I'm ready to start my IV. I'm going to take my chlorhexidine, depending on the kind that you have to use. I'm either going to squeeze like this and use the sides to open it, or I'm going to break the vial right here, and then the chlorhexidine will come down and I would rub that on my patient. We're not going to use these chlorhexidines because of the mannequins. So I'm ready to poke my patient. I've palpated, I've cleaned my site. I'm going to take the IV, and remember, I want the bevel to be up. So when I do this, I'm going to make sure that this white button is up, and I'm going to make sure that the longer side of the IV is down. I'm going to go ahead and I'm going to stabilize my vein. So that means I'm going to take my left hand, I'm going to use it to hold the vein stable above, and then I'm going to insert using my right hand. I'm going to go until I get blood return. You can see there's light pink blood coming back. Your patients will have bright red blood coming back. Once I'm inserted into the vein, I'm going to stop advancing the catheter. I'm going to hold the catheter stable with my right hand. I'm going to take my left hand and I'm going to advance the plastic cannula off of the needle. Then I'm going to use my left hand to hold this vein to prevent too much bleeding, and I'm going to retract the needle. I'm then going to attach my extension tubing. I would untie my tourniquet.
To remove a tourniquet, take the end that has the bow attached to it and just pull up and release the tourniquet.
I'm going to pull back and I'm going to flush. Now I'm going to take the syringe off. I'm going to clean up some of this blood so my tegaderm will stick. And I'm going to put the tegaderm on. Remember that I'm making sure the center of the tegaderm covers where the catheter goes into the skin, so right there. I'm going to take this paper off. I'm going to take a piece of tape. I'm going to secure the IV tubing. I'm going to clamp the IV tubing. And then I'm going to document on the label, I'm going to put the date, the time, the gauge, and my initials. I'm going to put that over the tegaderm but away from the insertion site. And then I'm going to clean up my supplies.